The U.S. Department of Health and Human Services has officially extended their public health emergency, originally set to expire at the end of July, now extended to October 22nd. It means flexibility in state programs, especially around Medicaid and Medicare, will continue. This impacts hospitals, providers, state governments, but especially state Medicaid programs. It continues changes along the lines of requirements that insurers cover COVID testing without cost sharing, a big one as states continue to increase their emphasis on testing. It increased federal Medicaid matching rates. That also comes with a slew of requirements that the states must follow that they now have to keep in place a little bit longer. We're going to give you some examples of potential end dates for the state of Wisconsin in just a moment. It continues changes around Medicare inpatient payments for COVID patients, waivers of telehealth restrictions, and the length of the emergency impacts the amount of shared losses an accountable care organization must then reimburse the Centers for Medicare and Medicaid Services. Now, the changes also continue to impact whether or not some prior authorization requirements will stay in effect, some temporary out-of-state providers being allowed to be enrolled without having to follow some of the other requirements. The delivery of care in alternative settings is still going to be allowed, and some federal hearing requests and appeals times continue to be changed from their normal standard. Now, we said we'd talk about the impact specifically in Wisconsin. Because this public health emergency has been extended, the state has been looking at what the most recent possible end date might be for some of the changes that come along with some of this flexibility. Now, for example, the Department of Health Services will continue their policy of not terminating people off of Medicare Plus or Medicaid. The earliest they could resume terminations would be December 1st, 2020. Public health emergency extended through October 22nd, which means the earliest someone could be terminated from Medicare would be December 1st. But of course, if the feds once again extend that public health emergency, this date too would change. Now, there are a couple other examples of timelines that have been pushed out. Wisconsin has paused premiums in its Badger Care Plus and Medicaid programs. Those would not resume until January 1st, 2021 at the earliest because of this public health emergency. The treatment needs question for childless adults that we have in the state of Wisconsin also would not return until January 1st, 2021 at the earliest. Renewals for healthcare programs are postponed through November. This does not include food share. This is just for healthcare programs. But a couple examples of how this national public health emergency is impacting policies and timelines a little closer to home. In the description below, we do share with you that Renewal, the public health emergency renewal statement, and the information of where we pulled some of those Wisconsin dates from, linked up in the description below.